Before performing cleaning and sterilization procedures, first put on surgical gloves. Remove the scanner tip from the intraoral scanner and place a protective cap on the handpiece to prevent damage to the optical lens and effectively block dust. Next, wipe the scanner chip with an alcohol wipe or cable wipes to clean its surface. Then, rinse the scanner chip under running water to ensure cleanliness. Afterward, soak the scanner chip in 75% medical alcohol for a period of time for surface disinfection. After soaking, remove it and rinse thoroughly with clean water to ensure all alcohol residues are removed. Wipe the scanner lens with a lint-free cloth. Then use an air blower to dry the surface moisture, or allow it to air dry naturally. Next, fold a clean, lint-free cloth to fit the size of the scanner tip window and insert it into the window to ensure proper protection. Place the cleaned scanner tip into a sterile bag and seal it properly. Finally, place the sealed scanner tip into an autoclave for sterilization at 121 degrees Celsius for 30 minutes. After sterilization, clean the exterior of the device with an alcohol wipe or cable wipes, and wear gloves to wipe it down to ensure hygiene. After wiping, place the handpiece back on the base, ensuring that the equipment is away from the edge of the table to avoid it falling. 1. During thunderstorms or when the device will not be used for an extended period, please make sure to unplug the power. To avoid storing the intraoral scanner and accessories in extreme temperatures or under direct sunlight. 3. Before storing the scanner, ensure that the scanner chip, handpiece, and base are completely dry. For storage environment requirements. Temperature range, -5 degrees Celsius to 45 degrees Celsius. Humidity range, 20% to 80%. Atmospheric pressure range, 70 kilopascals to 110 kilopascals. That's all for this video. If you have any questions, feel free to contact us anytime. Thank you for watching, and we wish you a pleasant experience.